Alrighty. Um, this is the second lecture and the last lecture. I've already recorded this once and I've lost it. I don't know where it is. So I'm redoing it. This is just a few more slides. In fact, most of you probably have this stuff already, but it'll be good for you to go and do it again. It's important to know that the abdominal cavity is separated into regions and it's separated into quadrants. Quadrants, you can remember, quad means four. You drive a quad, around it has four tires. If you're a quadriplegic, it means your extremities, your arms, and your legs, there's four of them, you can't move. So we have four quadrants and we have 9 regions. And it's important that you memorize these quadrants, okay, and the organs that are within them. So the RUQ right here is right upper quadrant. That's what it stands for. And it contains your liver. It contains the right kidney, and you can't see it on here because your kidney sits retroperitoneal or towards the back. And so you can't see it. It has your gallbladder, and we said before your gallbladder lies underneath the liver. And you can see right here we have our colon and part of the pancreas, which is sitting behind this stomach. Okay. That's my baby girl. Say hello, Rosie, my baby girl. Okay. The left upper quadrant, this is LUQ, the left upper quadrant, which is over here, patient's left side, which would be your right side. You could see that it contains the stomach, the left kidney, okay, that's sitting behind here, the spleen sits behind this area, the colon, you can see this big area right here is your colon, okay, and your pancreas is behind here, and then this thing here is your stomach. Our LQ is the right lower quadrant, and that contains the appendix. And then you can see right here it's got some more of the colon. See right here, this big, large, the dog keeps hitting my arm. Here's your colon. Here's some small intestine. Okay, you can see some small intestine in here. You have a ureter, and of course your ureter is connected to your bladder. And I know most of you know some of this because of the first day of school. And then it contains a major vein and a major artery to the right leg. And then finally you have your left lower quadrant. Your left lower quadrant contains your colon. You can see that nice big juicy worm looking thing, your colon, and your small intestine. And it contains a ureter from the other kidney, and then a major vein and a major artery. Okay, and then it has midline, and you can clearly see what it contains. Now we have the regions. We have the regions are more specific. It's more of a precise method. And we have the, we'll start with the umbilical region, because you can put your hand on your belly button, put your fingers on your belly button, and you're going to see that umbilical, umbilicus, belly button, that's your umbilical or umbilical region. Okay. To the right of that, or the patient's, that's the patient's right, you'll have the right lumbar region. It's called lumbar because it's adjacent to the spine that's resting back here. Okay, this is your lumbar spine back here. And then to the other side, your left lumbar. With your fingers on your belly button, and I hope most of you have your finger on your belly button right now while I'm saying this, right below your umbilical region, you have your hypogastric region. Hypo meaning below, right? Hypo below, hyper is above, or epi is above. So, where is I going with this? Oh, your hypogastric region is right below that is your hypogastric region. And then to the right, you have a right iliac region and a left iliac region. Iliac, if you can just think of, you have an iliac crest down in there, okay? I can't get my pointer to work. You have an iliac crest somewhere in this area. And then if your finger is still on your umbilical region, right above your umbilical region, you have your epigastric region. Epigastric is a lot of times where your discomfort comes from when you have like heartburn and indigestion is right in the epigastric region. You have your epigastric. And then to slightly to the patient's right side, you have the hypochondriac region, and then you have the left hypochondriac region. Okay. Next, we have three small cavities that need to be mentioned. We have an orbital cavity. Orbits contain our eyes. And then we have the nasal cavity, which has our nasal structures into it. And then we have the buccal cavity. The buccal cavity is the mouth. And that's where we house our teeth and our tongue. Okay. Buccal cavity every year tends to be on the tests. So you might want to star that. And then right here, this is from chapter 20, giving you a heads up. I'm not going to do this now. I'll come back to it later. And in fact, I'll probably have this as homework as another video for you guys to watch. I'll come back to it and do it. I want to do this next week with the integumentary system. So I'm done with this lecture. This should be Wednesday. You should have all your notes written out, and I need them handed in to Mrs. L. And then you can continue doing your work. Tomorrow you're going to start the integumentary system, and then that's Thursday, right? No, that'll be Thursday. So today's Wednesday, and then Thursday I'll start the integumentary system, and I will have a little overview of what's going to be on the test for you guys on Monday, because you will be tested on the planes and directional terms and the quadrants. Now, there are games that you can play on here on your Moodle website that I can take you that will help you learn the directional terms. You're more than welcome to do those and use those and play them at school or at home as long as your work is done. All right. So I'm going to sign off for now, and then I will start with the integumentary system. Okay.